We've all, of course, been paying a lot of attention to the alarming news about Ebola virus, but there is another virus abroad in the land today that is probably, we hope, much more likely to be a problem for many of us than Ebola. It is something called Enterovirus D68. Dr. J. Michael Klatte is an infectious pediatric disease specialist at Baystate Medical Center. He is here with us to talk about that virus. Doctor, thank you so much for coming in. Appreciate your time, sir.
Thank you for having me, Jim.
Enterovirus D68, one of 100 or so non-polio enteroviruses. But how serious, from what you've seen and what you've read, is this particular D68 strain we were hearing about this year?
So we have noticed in terms of infectivity and how rapidly it has spread that it has been relatively significant. However, in terms of the severity of symptoms, in my own personal experience, treating patients here in the Springfield area, the degree of symptoms in terms of severity has been relatively mild.
Okay. And am I right that an enterovirus, and obviously there are many of them, more than 100 or so, not at all uncommon? I mean, it's not unusual. It picks up on average in the warmer weather, starts to abate about this time of year as things cool off a little bit. But this year, I guess, the excitement about or concern about Ebola, and when a new virus or stories, it kind of attached itself to those Ebola stories, and we thought, wow, we're getting a double whammy here. We're getting hit by two. Did the seriousness of it get blown a little out of proportion, do you think?
Well, I don't know if I can comment on that, but we know that enteroviruses in general in the United States, you have approximately 10 to 15 million symptomatic infections per year, a large majority of which are in children. And we know that there are, from surveillance that has been done by the Centers for Disease Control, that there are certain strains that predominate every year, and it seems as though D68 has been the one that has predominated this year in particular.
There were reports, and I know specifically it's called a non-polio enterovirus. There was concern a few weeks back, I think in Denver, and I think in the eastern part of this state as well, that they were seeing some cases, young kids who were in hospital and seemed to have some leg paralysis, some problems with the leg muscles, and red flags kind of went up for a few days, it seemed. Can you tell it, what was that about? Was there some connection? Do we think that was not as big a problem as we may have thought for a few days?
So in terms of the commonness or how common that side effect from the infection is, extremely rare. And I think part of the reason that more cases have been detected or picked up here in the United States is a heightened awareness of the enterovirus D68 infection and its rather large media coverage. We know that from previous studies that have been done on non-polio enteroviruses, there are certain strains, including Enterovirus 71, for instance, that are rarely, and I want to emphasize rarely, known to result in paralytic symptoms similar to polio. So if there was an association between Enterovirus D68 and these paralytic symptoms, I would not be surprised. However, based upon everything that I have heard and the research that I've done with enteroviruses, I don't think that that's necessarily more than any other type of enterovirus strain.
Nicely said, and let the record show I was the one that said nasty stuff about the media, not doctor. Okay, so let's talk about EV68. And again, now we're hearing a lot of people concerned about how the very serious Ebola virus is transmitted, and we're being told it really isn't easily transmitted. It's quite a different story, as I understand it, with the EV68 and enteroviruses in general, correct?
Well, in terms of enteroviruses and their transmission, generally coughing, sneezing, changing children's diapers, those types of things. We also know that adults can and do get infected with enteroviruses. However, adults over the course of their lives have been exposed to a number of these viruses because different strains circulate, every few years, at least based upon what we've learned. And so adults do have some degree of immunity, and their symptoms can be rather mild. So I imagine that there probably were a lot more adults out there with very mild Enterovirus D68 symptoms than we were aware of.
It just doesn't, for most of us, most of the time, really kind of kick off the alarms because it's not that serious, and I guess that's different for every person, but is that fair to say?
Right. And, again, one of the reasons that we saw it so widespread in children was because they don't have the underlying antibody defense systems that adults who have been exposed to it in the past have been.
Who does need to worry about an enterovirus or D68 especially? I mean, we always hear, older folks, if you have some kind of pulmonary problems or an asthma, is that true in this case?
Well, in terms of the pediatric population, we know that children with asthma, and particularly poorly controlled asthma, or individuals who are not on their scheduled medications as they should be, are at increased risk of more significant breathing difficulties if they were to develop infection with Enterovirus D68.
What are the symptoms we should watch for, and when, and again, maybe this is, past time to some extent, as you said, it's really waning at this point, but we certainly did see some serious cases a few weeks back, and we saw some people in the hospital. Certainly you had some at Baystate. What should say to people, this is more serious. This isn't just a passing flu bug or what sometimes people used to call the grip. We got to get in and see the doctor, maybe get in the hospital.
So certainly with increased difficulty breathing, we have seen that children with this infection, whether they have a history of asthma or not, can manifest with asthma-like symptoms, including, again, severe difficulty breathing in terms of, you can see your children's rib muscles sucking in and out, an increased respiratory rate. You might not necessarily see, a high degree of fevers that you would with other enteroviruses. But certainly I think the breathing issue is the most important thing if you were to watch out very closely for this virus.
If you see a serious case of EVD68, how do you respond? How's it treated?
So we found, particularly at Baystate, that aggressive doses of medications used to treat asthmatic patients and at higher doses, particularly in the children who have been seen in our emergency department, namely the medication albuterol, have had really beneficial effects on our patients. And in fact, I believe that the aggressive management has been one of the reasons, and again, possibly an association, I don't have any definitive proof, but one of the reasons that at Baystate we have not seen any children who have required a breathing tube or extraordinary measures in terms of life support. And so we've found that the aggressive breathing treatments have been very beneficial for our patients.
Real quick, I guess it's like any other cold or viral disease. What's the best way to protect ourselves? Just common everyday, keeping clean?
Of course. And, again, even with the Ebola virus, it's being aware of your surroundings, being aware of your own hygiene, in particular hand hygiene, washing your hands 15 to 20 seconds, particularly after you've had contact with, lots of public places, always making sure to change your children's diapers, and wash your hands thoroughly afterwards, dispose of them properly. So really things that, some people kind of take for granted, but it's something that is extremely important in disease prevention overall.
Well, Dr. J. Michael Klatte, Pediatric Infectious Disease Specialist, Baystate Medical Center, thanks for your time, sir.
Thank you so much, Jim.